to the
Okay, well,
camera.
you look great. You are all
Oh, thank you.
you're in the frame. Everything looks fabulous. Okay,
Okay.
awesome. So, hi, Grace. Grace is joining us from Miami. So, anyway, I'm here with Dr. Elizabeth Lee. She is a plastic surgeon here in the Bay Area. She actually practices down the street from me in Lafayette. So I'd love for you to introduce yourself a little bit more, and then we'll get into some of the topics that we have for today.
Great. Thank you. I, as you heard, I'm Elizabeth Lee. I'm a plastic surgeon, and I practice in Lafayette, right down the street. And we're talking today, I think, about tummy tucks and the significance of abdominoplasty in correcting and restoring the actual muscle layer of the abdominal wall. It's not just about getting rid of loose skin. So there's a huge functional component that needs to be repaired in the average abdominoplasty.
Yes, and so I think this is such an important point because as a gynecologist, a lot of times when I hear patients talking about plastic surgery, it is about tummy tucks, especially in the 40s, 50s. People are talking about the mommy makeover, right? After having
Right,
kids, they want their stomach flat. So it's more of an appearance and a feeling kind of topic that comes up, not really a kind of functional one. So we've talked
right.
about that before, and so that's why I thought it would be really important to talk a little bit more about that. So when our abdominal walls are, not quite tight, and are expanded after childbirth, etc., it can lead to all sorts of symptoms. So what are some of those?
Right. Right. So what happens with pregnancy is that we stretch out this way. We all see this, but we can also stretch out from side to side. And what happens when that happens is that the muscle layer can stretch too. So we all see stretched out skin. And if we have stretch marks, we know that that's never going to come back to its original shape. But what is often underappreciated is what happens with the muscle. And in particular, the two muscles that run right up and down the center of the abdominal wall are called the rectus abdominis muscles. And the connective tissue between them can stretch. And it doesn't happen to all women, but it happens to a fair number of them. And as that connective tissue stretches, there's no elastic recoil to that tissue. So after delivery, the baby's no longer in there. Things do tighten. Muscles can tighten back up, but that connective tissue never comes back to its original size or strength. And so the rectus muscles now sit out to the side instead of being right up against each other. And that sets up a whole imbalance of the muscle function of the abdominal wall. So when muscles are not in the right position, they don't work properly. And also, when they are not at the proper length of stretch, they're not as strong as we would like them to be. So once we have that muscle separation, not only is the rectus muscle not in the right position, but the other abdominal wall muscles that people may have heard of, called the internal oblique, the external oblique, and the transversus abdominis, those muscles end in the outside border of the rectus. So if the rectus is hanging out there an inch or two too far to the side, those other abdominal muscles are also not being held out to the proper length. And so there's no question that you can do muscle activation exercises and learn how to actively pull that rectus back into the center, but that's active work, and you can't walk around holding your abdominal wall in like that all the time. It has to be anchored. Those two muscles need to be anchored back to each other in the center in order to reestablish a functional core.
Okay, so that is a good point. So what we're talking about here is really diastasis, right? Diastasis recti,
Yes,
right? That's a
yes,
our viewers may
thank you.
kind of be more familiar with that term. A lot
Right,
of women after
right,
childbirth, their core is coming apart. It's really the rectus muscles that really haven't come back together, or will probably never be the same as it was
Right.
pre kids. And so this is called diastasis recti. And then there are people doing all sorts of things to try and fix this, including types of crunches and other
Right.
workouts and Pilates and yoga, right? There's a lot that
Right.
people are doing, and some of that may work to a certain extent. It can help, but as you mentioned, it's
It
not.
can also make it worse.
Yes, I think there are certain types of
Yes.
crunches that can definitely make it worse, and people are,
Right.
pounding those crunches right after, that 6 week mark, but it can actually make things worse. Now,
Right.
you had said how, okay, if these muscles don't, if they're not connected again, it can really affect the oblique muscles as well, and the
Hmm.
core is just not set up right. So other than
Right.
actually feeling a bulge in the lower abdomen, or some women say a pooch, my baby pooch never went away.
Hmm.
Other than the cosmetic aspect of it, how else does this functionally affect women?
Well, the most common thing that patients can develop is back pain. And that can happen because if your core muscles are not functioning properly, you're not supporting your back. It can also take the form of I once had a patient come to me to say she was there because she couldn't breathe. And I said, well, I'm not a pulmonologist. She said, no, no, no. I went to a yoga retreat and we're doing all this breathing and I can't breathe because all I'm doing is holding my stomach in actively, so I can't take a deep belly breath. There can also be some changes in the often underspoken of part of the core, which is the pelvic floor, where if the abdominal wall is out of balance, the pelvic floor can also not be supported really well. So I have had patients have improvement in things like urinary stress incontinence just by repairing the rectus diastasis and pulling those rectus muscles back into the proper position.
Okay. So if you're somebody who's having lower back pain and you have this recti, this may be, time to see a plastic surgeon. You can definitely be doing the yoga and the Pilates to strengthen your core, but it may not really completely fix the problem. So tell us a little bit
Right.
about, how does one, do all plastic surgeons do this procedure? How do we go about finding somebody who does this? What is the medical term for this procedure?
Okay. So I most plastic surgeons are fully trained in doing what is commonly called a tummy tuck, and we refer to clinically as an abdominoplasty. And an abdominoplasty is a repair in two layers. The first layer is taking out that extra skin, but the second layer of the repair is plicating or tightening the fascia between the rectus muscles so that the rectus comes back into position. It is important in this day and age, I believe, to understand the training of the person who is operating on you. And there's a wide range of physicians who are surgeons who will call themselves cosmetic surgeons. Anybody who is trained and boarded by the American Board of Plastic Surgery will have learned how to do abdominoplasties, and most people do a really good job at that. So what I like to do is encourage patients to come in for a consultation, and during that consultation, my goal is to help them understand number one, what's going on with their bodies and what might be giving them the concerns that they have, and number two, what the options are to fix those, because a consultation is about education.
Mhm.
So people need to understand.
Yeah. Okay. So, are there different types of tummy tucks, or is it a pretty standard way of doing it?
That's a that's a great question. So there are different approaches to abdominoplasty. They all involve taking out some skin through an incision that's made kind of in the area where you would have an incision for a C-section, although it'll come out further to the sides in order to be able to take out some skin. And it will involve often doing something to reconstruct the belly button, which often gets stretched out during pregnancy too, and the muscle tightening if it's necessary. But then there are things that called like a mini tummy tuck or a lower tummy tuck, which only works on the area below the belly button. A full tummy tuck will involve working on the muscle layer all the way up to your breastbone, down to your pubis, and taking out as much skin as needs to be taken out. I will tell you that a mini tummy tuck really serves very, very few patients, because most patients may have more fullness in the lower part of the belly than they do in the upper. But when we tighten that lower part, then they get to see the bulge that they really do have in the upper, because it's left behind. We're not doing any work in the upper. So it depends. I have operated on several patients who really were good mini tummy tuck candidates, but the majority of people need a full tummy tuck.
Need the full thing. Okay. How long is this procedure? Like a full tummy tuck?
So a full tummy tuck in my hands takes about 3 hours. That is the time the patient gets into the operating room until they leave the operating room. So that includes the time that they're getting them situated on the table. General anesthesia is used for this case, so the anesthesiologist puts them to sleep and then wakes them up at the end and gets them out. So I might be operating for 2.5 hours of that.
Okay. And then what about the recovery?
So the recovery is pretty significant. And I think that it's really, really important to help patients understand what they need to do in order to take really good care of themselves. And I tell patients that if their major activity is working at a desk type job, they need to plan on being off of that job for 2 weeks. And then they could go back to all the activities around work. It's a really serious conversation to have with people who have young children at home, because you won't be lifting the baby up to put them in the crib, for instance, for probably a good 6 weeks, particularly if the baby is over 30 pounds. So you need to plan to have a really good recovery and to have enough help so that you can take care of yourself and get enough rest.
Yeah, that's a great point. I actually remember a patient who came in for her annual GYN exam, and I was, going to do her abdominal exam. She's like, "Oh, don't touch me. I just had a tummy tuck." But it was like already more than 3 weeks, but she was still recovering from it. So I think that's a great point that you mentioned. Like, yeah, you can't really be lifting young kids, heavy things for a good 6 weeks.
Right.
So if you are somebody who's very active, you have a job that requires a lot of lifting, you really do need to think about that recovery time.
Right. And then I also like people to really think about the fact that in my hands, no matter what surgery I do, it can be as little as taking a little bit of skin out of the upper eyelids, or as big as a big tummy tuck with liposuction combined with a breast reduction. And there is a 6-week period of time where your body is doing a lot of healing, and all the healing that you do occurs during sleep. And so you will be fatigued because your sleep requirement goes up. And patients do so much better when they know what to expect in recovery, and they can really take care of themselves and make the appropriate arrangements, to not do this leading into a big project that they're going to have to be finishing at work, and making sure they have enough help with their kids. Because, we're partnering. I'm partnering with my patients. I can be a fabulous surgeon, but their overall outcome is much more dependent on how well they're able to take care of themselves in the postoperative period.
Yeah.
So
okay.
Don't underrate that.
Yes, definitely. We have a question from a viewer. It says, if someone has a tummy tuck for a few years and sat for long hours during the recovery time, was that improper? So sitting after surgery versus, I think, laying down, does that matter as much?
Well, are they having a specific problem? So I would say that sitting early with abdominoplasty puts the majority of the weight in terms of what we call dependency, which is where the fluid and the blood end up settling on that incision,
Mm.
right? Because the incision is sitting right in
Yes.
your lap. And so I would say that spending a long time sitting up could cause wound complications early on. And by wound complications, I mean that you could end up with some of the wound opening up, which would then require wound care to get it closed, and the scar won't be as nice in that area. I generally do not tell my patients that they have to stay on strict bed rest, but I will also say to them, I really don't want you in the first 2 weeks sitting up in a chair for longer than maybe to eat a meal sitting at the kitchen
Yes.
table
Yes. Okay.
for that reason.
Yep. Okay. That makes sense. Okay. So the takeaway for me for this part of the conversation is, diastasis or the separation of the rectus muscles can cause back pain, can cause pelvic floor issues, and while some of these other non-surgical options can help, they're not really going to fix the problem until these muscles really come together. And this is what's called tummy
Exactly.
tuck or abdominoplasty. You can see a general surgeon for it. And not,
No,
I'm
not a
sorry, not a
general
general
surgeon,
surgeon,
a plastic
a
surgeon.
plastic surgeon
Thank,
for it.
that's right.
Yes, plastic surgeon, someone who's trained in this procedure. And tell us where people can find you.
I'm located in Lafayette. My practice is called Artful Surgery. You can find us on the internet at artfulsurgery.com. There's contact us information through there, through the website, and our phone number is 925-299-1985.
Awesome. And how long, how quickly can patients get a consult in with you? What are your wait times? Because I know that's always a big concern for many people.
So we want to leave a couple of slots open for consults at all times. So I would say that we can usually get you in for a consultation within 2 weeks of your calling, and usually shorter than that, but
Yeah.
it can take 2 weeks.
Okay, great.
Yeah,
Awesome. So
yeah,
before we end, though, I wanted to talk a little bit about breast implants and kind of breast
yes,
surgery. I know we had
yes.
talked about this, and this is a common question that, comes up all the time in the office, in all types of capacities. There are patients who've had implants 30 years ago, and then they're like, oh, should I
Mm,
remove them? Do I need to change them? There are other patients wondering if they need to get breast reduction for back pain. We had talked about tummy tuck for lower back pain, but sometimes
mhm.
upper back pain. So
And neck pain.
yeah, and neck
Yeah.
pain. So I was wondering if you could give us some thoughts about, cosmetic surgery for the breast, and, what are some considerations that women need to be thinking about?
Absolutely. So I'm going to run through some frequently asked questions and not necessarily discuss like this all
Yes,
globally.
perfect.
But one of the really interesting things that I find is that patients kind of have this idea that their breast implants have to be changed out every 10 years. I don't know where that comes from. And they're not like doing an oil change in a car. So breast implants are mechanical devices. They can fail in that the shell can crack. The body can also develop reactions to it, such as a capsular contracture, which means that the scar capsule that your body makes around every implant can, in the case of scar contracture, get thick and tight and displace the implant or make it feel hard. And that is a problem with the implant. But if your implants are in and they're soft, and you like the way your breasts look and everything is comfortable, then you do need to get mammograms and you do need to be followed with physical exam. And the plastic surgery societies, the ASPS and ASAPs, are currently working with the FDA to solidify recommendations of following the integrity of breast implants, particularly silicone ones, with ultrasounds, because ultrasound turns out to be the best tool to make sure that there is no rupture of the shell of the implant. But if you are doing this surveillance and your implants are not bothering you, you do not need to take them out or exchange them just because they're 10 years
Okay,
old.
that's
So
such a good point because
isn't
so many patients
that
tell me,
interesting?
yeah, because so many patients tell me, oh yeah, I was told that after 10 years. And I'm so glad we're having this conversation because yeah, I was like,
Yeah,
which one is the right one? And other patients, have them for years. Okay, but I
right.
like the point also about the ultrasound because many patients
Yes.
are often wondering, oh no, like, does this mean I'm not getting a very good, thorough exam? Are they missing something? So the ultrasound is going to help. Okay, good.
Well, and the ultrasound is also, the ultrasound I'm talking about is specifically looking at the implant.
Hmm.
I'm not talking about an ultrasound that you would do for breast cancer
Oh, got it.
surveillance.
Okay.
So, okay, so they're done differently, but the implant itself should be surveilled starting at about 3 years, particularly when they're the silicone gel ones. And the reason I differentiate between the silicone gel versus saline-filled ones is that if a saline one develops a defect in the shell of the implant, you're going to know it because it's a water balloon and it's going to deflate. But the
Yes.
silicone gel is much more firm, and so you can have a crack in the shell and you don't have silicone running all over the place, right?
Yes.
Which is
Yes.
good.
Yes.
They're very cohesive these
Yeah.
days. Yeah. So that's number one. Let's debunk the 10-year rule. Take care of your breast implants, make sure you're comfortable with them, make sure that you're getting appropriate mammograms for your age, and consider getting ultrasound studies to check for the integrity of the implant. And if the implant changes, if your breast increases in size, if you develop pain, if it gets hard, then obviously that's the time to go and see your plastic surgeon and figure out what needs to be done to figure out what's happening. But then the other thing that happens with breast implants, and I tell this to all my pre-op breast implant patients, you, if you get them in 20 years before you're 80, you're pretty much 100% guaranteed of needing another surgery on your breasts just because you have these implants. And it may be because you develop a problem with the implant, like we discussed before. It may be that you just reach a point where you no longer want them. And as I explain this to my pre-op patients, they all say, what are you talking about? I really want them and I'm never going to not want them. But it is really interesting to see that our feelings about our bodies change and evolve so that 15 years from the time you got the implant, you may have had a couple of children, right? You may have gained a little bit of weight. You may have lost a little bit of weight, but your body has changed and your need of those breast implants changes too. And you may just be coming in and saying, you know what? I'm done with them. Take them out.
Yeah. Yeah, that's yeah, I think many women don't give themselves the permission to do that because they see it as like, oh, okay, I got it. So now I'm stuck with them or, this is a lifelong
Right,
thing. So um
right. And it's not.
that's yeah, that's a great point. That's a great point.
Yeah.
As far as, with dense breasts now, many women are getting ultrasounds to look at the breast itself. I mean, you had mentioned ultrasounds to
Mhm.
look at the implants. Is that something you routinely advise as well for those with breast implants, or it just depends on the person and their density?
A lot of this has to do with the medical system in which we're working and in which each patient is working,
Mhm.
unfortunately. I, as a breast surgeon, I feel pretty strongly that if a mammogram is is being read as, dense breast tissue,
Mm-hmm.
cannot evaluate all the tissue, that those patients would benefit with an ultrasound for screening.
Yeah.
But the presence of a breast implant doesn't change that in any way. The breast implant is not actually in the breast. It can be placed in one of three positions, but they're all underneath the breast. So one can be directly under the breast, one can be underneath the pectoralis muscle or the big chest muscle, which separates it completely from the breast. And one can be now in what we call a subfascial position, which is that the fascia or the connective tissue covering the pectoralis can be lifted and the implant put in there. But in any of those three positions, the implant is not in the breast. So when you do mammography, they need to know that you have breast implants, and they will work harder to pull the breast tissue off the implant so that they can visualize the entire breast,
Yeah.
even with the implant in there.
Okay. Okay. That makes sense. All right. Well, so much useful information about breast implants and tummy tucks and reasons why we would, really consider even an abdominoplasty and other than just cosmetic reasons. So,
Absolutely.
yes. So,
Functional.
functional, yes.
It's
We want to
yeah,
feel good. We
yeah.
want to have a good core. We want to have a good pelvic floor as well, and
Mhm.
be able to do the things that we want to in life. So, thank you
Right.
so much for coming on, Dr. Lee. If you are
Thank
watching
you for
this,
having me.
yes, absolutely. If you're watching this at any point and you're considering these procedures, make sure you check her out in Lafayette, California. Dr. Lee is amazing. She's a wonderful surgeon and a
Thank you.
great person. I've met her. And yeah, and drop any questions below, whenever you're watching this. And thank you so much for coming on, and we'll
Thank
touch base
you.
again. Okay. Bye,
Okay.
everybody. Bye.
Bye.
Bye.